Hello everyone and welcome to the presentation by Neem and I. Today's presentation is going to be on an anti-seizure medication called Phenobarbital. Phenobarbital is a part of the barbiturate anticonvulsant category class and also the hypnotics. Phenobarbital is part of the Schedule 4 class for drugs. It comes in tablet form, liquid form, and injectable solution. And each dose varies depending on what the doctor thinks is necessary to control and what they're trying to control. It can be used to treat status currently as epileptic, so you've had more than 2 seizures. Either it can also be used to treat just plain seizures, and then it can also be used for sedation effects, hypnotic, and also for treating insomnia. Barbital can be used to control seizures, relieve anxiety, relieve withdrawal symptoms while coming off of the effects of other drugs. It can provide sedation. It can treat insomnia by providing a hypnotic effect on the person. Phenobarbital can be administered 2 ways: through an IV injectable solution, or it can be used orally through a liquid or a pill. Indications of phenobarbital is someone with hypersensitivity, porphyria, which is a condition where natural substances can build up in the blood and cause stomach pain, changes in behavior, and other symptoms. It is contraindicated to be given intraarterial. If someone has severe hepatic impairment, COPD, dyspnea, they are currently pregnant or lactating. Commercial injection is highly alkaline and may cause tissue necrosis if given subcutaneously or if it extravasates. Avoid drinking alcohol if taking phenobarbital because this may increase your side effects. You should also know that it can decrease the effects of birth control. It can harm a growing fetus if taken if someone is pregnant, and many contraindications with other drugs, so make sure you tell your doctor of any other medications or vitamins you may be taking. Some adverse effects you may want to watch out for is drowsiness, headache, vomiting, dizziness, excitement or increased activity usually seen in children, slowed breathing, swelling of eyes, lips, or cheeks, rash, blistered skin, fever, confusion, vertigo, nystagmus, irritability, or mental dullness. And as PTs, it's really important that we watch out or know how our patient's reacting to the drug, especially if we're going to perform any type of exercises, walking, and there may be vertigo or confusion or dizziness.
Mechanism of action. It depresses sensory and motor cortex and cerebellum. Anti-seizure activity occurs primarily where GABA mediates neurotransmission. Hypnotic effects of barbiturates result from activity at GABA receptor in the polysynaptic midbrain reticular formation. Off-label use of hyperbilirubinemia. Phenobarbital induces glucuronidtransferase and hepatic bilirubin binding Y protein to lower serum bilirubin concentration. Pharmacokinetics. Absorption. Bioavailability is 70 to 90%. Onset is 5 minutes intravenously. Duration is 4 to 6 hours intravenous or intramuscular. Peak plasma time is 8 to 12 hours. Therapeutic plasma concentration is 10 to 40 mercury milliliters and may require 3 to 4 weeks of treatment to achieve therapeutic levels. Distribution protein bound is 20 to 45%. Metabolism Metabolized by hepatic oxidative hydrolylation. Metabolites are inactive. Elimination half-life is 50 to 140 hours. Excretion is mainly done by urine. Does the drug require monitoring? No. This drug can be taken orally by an individual at home without continuous monitoring, but they still can be at risk for overdose. If someone has overdosed and has serious symptoms such as passing out or trouble breathing, call 911. Otherwise, call a poison control center right away. US residents can call their local poison control center at 1-800 222 122. Canada residents can call a provincial poison control center. Symptoms of overdose may include severe tiredness, dizziness, inability to wake up, and slow breathing rate. Special considerations. Do not take this drug if you are pregnant or thinking of becoming pregnant. Don't take it with alcohol. Don't take this drug with any drugs that were not discussed with your doctors first. For instance, daruvinary, etravirine, orlistat, rilpivirine. Check cold or flu medications because they may have these products in them. Do not stop this medication abruptly due to severe withdrawal symptoms. Physical therapy implications of the drug. Talk to a nurse or read previous notes to see how the patient is responding to the medication. Monitor the patient during therapy and look for adverse effects such as fever, confusion, vertigo, nystagmus, irritability, and dizziness. Overview of studies. The study is about bone loss associated with the use of anti-epileptic drugs. The effects were disturbed bone mechanism, reduced bone density, 2 to 6 times increased risk for fracture. Caution to the clinicians. The clinician should promote osteoprotective behavior among epileptic patients. Recommendations as well. Bone mineral screening for patients with long-term use of anti-epileptic drugs.